Yeah, hi everyone. Good day. It's me again, Dr. WAN here to talk about low sperm count, known in big grammar as oligospermia or oligospermia. What is it actually? What can be the cause? It's becoming a big issue right now, not only in Africa but globally. And I'm here to treat this topic. By the way, I'm not a urologist nor an andrologist. I'm just a healthcare professional, and I'm just want to bring an insight to this problem that so many young people have approached me. So let's see what is it actually and how it can be managed. So low sperm count is referred to semen with a low concentration of sperm and is a common finding in male infertility. Often, semen with a decreased sperm concentration may also show significant abnormalities in sperm morphology and motility, technically known as oligoasteroteratospermia. Yeah, the name looks kind of long, but it just goes to summarize everything which I've just said before. There has been interest in replacing the descriptive terms used in semen analysis with more quantitative information. Now, diagnosis, obviously, in this case, you just have to go to the hospital and they will do some diagnosis in order to arrive at the conclusion. That is, the diagnosis of oligospermia is based on one low count in a semen analysis performed on 2 occasions. For many decades, sperm concentration of less than 20 million sperm per ml were considered low or oligospermic. Recently, however, the WHO reassessed sperm criteria and described a lower reference point, less than 15 million sperm per ml, consistent with 5th percentile for fertile men. Sperm concentrations fluctuate daily, and oligospermia may be temporary or permanent. The diagnosis of oligospermia requires workup via semen analysis. So, what could be the causes of this trouble? There are a whole lot of things here which I don't want to make this video quite long, otherwise it becomes boring for someone listening. But I'll just touch the essential part here. So the essential ones are drugs, alcohol, and smoking. If you are involved in these 3 things, then you are one of them. There's that high risk. Another one is strenuous riding, like bicycle riding, horseback riding. That's another causative factor. Then you have medications. Medication here we include androgens. So that's the first one. So I call this one pre-testicular causes. Sorry. Pre-testicular factor refer to conditions that impede adequate support of the testes and include situations of poor hormonal support and poor general health, which include what I just named before. Then we have testicular factors. Testicular factors here refer to conditions where the testis produces semen of poor quality despite adequate hormonal support and include age, genetic defect on the Y chromosome microdeletion, abnormal set of chromosomes which is called Kliefeld syndrome, neoplasm, and you can name the rest. So those are the factors. Another case again could be how frequent you have malaria disease. So that one is quite interesting because most people seem to underestimate the impact of malaria. Then diabetes also is not left out in this case because it impaired the gonads, the way they produce sperm quality for those who have diabetes. So you need to get yourself treated if you have any of these two diseases, say malaria and diabetes. And we do have also what we call hydrocele. Hydrocele is another factor that contributes to it. Mast cells releasing inflammatory mediators appear to directly suppress sperm motility in a potentially reversible manner and may be a common pathophysiological mechanism for several of the above-mentioned factors. Now, we do have another one called post-testicular causes. Post-testicular factors decrease male fertility due to conditions that affect the male genital system after testicular sperm production and include defects of the genital tract as well as problem in ejaculation. We have the vas deferens obstruction, lack of vas deferens, often related to genetic marker for cystic fibrosis. Infection is another one. For instance, if you are suffering from prostatitis, that's another factor there that has to be looked into. You have the ejaculatory duct obstruction. So those are some of the things that you need to look into. So we have 3 ways to evaluate the situation. And then when it comes now to another factor such as genetic changes and then inflammation. So for those of you having any inflammation, I will suggest you get something just basic, generic, or simple, that which is natural. You don't really need to go into anything synthetic because you don't want to aggravate your situation. Typical example is turmeric. When you have turmeric at home, add it to ginger and pineapple. Again, turmeric, ginger, and pineapple. These 3 things, put them together and make a syrup to eliminate pain, because when it's inflammation, it impairs your ability of producing sperms. It affects the sperms count. So that's what I want to stress here. And then you can now see an expert in that field to make sure that you are not suffering from any of these conditions, which we call hydroceles, varicocele, or vas deferens obstruction. If they check those organs and they are functioning, then you should be good to go. So in this case now, they can just put you on a particular, we call them supplements. So I can give you a good example, which is Proxy. Proxy is a good one. You can buy it from the pharmacy or anywhere and use it, and things should be fine. Proxy is loaded with arginine, which contains 500 milligrams. There's vitamin C, which is 90 milligrams. There's N-acetylcysteine, which is 50 milligrams. Vitamin E, which is 30 milligrams. Iron, which is 7. And there you go with all other aspects of things. So that's what I do recommend to all patients if you're having this condition. So take home message: refrain from alcohol. Alcohol is not a good thing, especially for young generation. When you have to put up a family and you need to make up children, then you need to refrain from abusing alcohol. Same thing also for drugs. Be careful what drug you take, medication, that one, you need to know also which one to take in order for you to live a better life. So having said that, I will come to the end we are now at the end of this presentation. If you have any question, please feel free to ask me. You have my email address, you have my phone number. You can call me whenever you want or reply back to my YouTube channel and I will address it. So far, so good. My name is Dr. WAN. Thank you for listening and have a wonderful day. Ciao.